This is how this low-cost unit works, assisting breathing function. It pushes more air into the lungs. It is the brainchild of 4 engineers at the Nelson Mandela University. The ventilator meets the World Health Organization requirements. They prescribe the volume that must be delivered to the lungs, the minimum number of breaths per minute, and the inspiration-expiration ratio. The prototype was created in just 7 days.
So our market is effectively low-resource hospitals, like in Garankuwa, Soshanguve. So these are the markets we've effectively looked at since, a ventilator costs something north of 600,000 rands. So, looking at how much these ambu bags cost, and then automating this bag will cost, will get the cost around 5,000 rands.
Most COVID-19 deaths are caused by acute respiratory syndrome. In short, it means the lungs are unable to exchange oxygen and carbon dioxide sufficiently due to the fluid buildup. Treatment is mechanical ventilation. This device will also allow a mixture of oxygen and ambient air to be pumped into the lungs if required.
So we've developed the product with the advice of a pulmonologist and anesthesist, and we've looked at the World Health Organization standards. Our device is not clinically tested and improved yet, but we're gearing ourselves towards getting that approval and testing done. It's at this point in time, hopefully we won't need this device and the virus won't peak, but we are gearing ourselves towards if the virus peaks, we will be ready.
In the case of mass hospitalization, it is anticipated that SADC countries may look to South Africa for assistance with medical equipment like ventilators.
So I think it's very important to note that by designing and supplying a cheaper and a more low-cost ventilator, you could save a lot more people. The biggest problem is that a lot of the rural communities that's in desperate need of medical services can't actually afford these services.
But doctors warn that ventilators must not be seen as a cure for the coronavirus and diseases linked to it. It is only a support mechanism while treatment is administered. More importantly, doctors say ventilators must be clinically and tested and approved by the Department of Health.
In the intensive care unit, we make use of ventilators with advanced capabilities, and we need these capabilities when we ventilate patients with respiratory disease. Unfortunately, ventilating a patient with COVID is not the same as ventilating a patient with a drug overdose, for example. So a patient with a drug overdose has nothing inherently wrong with their lungs, and they tend to be easy to ventilate. Whereas a patient with COVID has lung disease, the patients are far more difficult to ventilate.
Projects like this fall under the National Ventilator Project, initiated by the Department of Trade and Industry. The aim is to produce 1,500 ventilators by the end of May, ramping it up to 10,000 units by the end of June. It is estimated that 80,000 ventilators will be required in South Africa should the pandemic reach the predicted peak levels. Lerato Fekisi, SABC News.